laying a black cloak of death over the female population. Heart disease is soon to be the #1 cause of death in women around the world. Many Americans wouldn't think it, but heart disease, an often overlooked disease, affects more people than cancer. Nowadays, women need to take the initiative from being in the next heart disease statistic. Heart disease, also known as cardiovascular disease, is the narrowing or blocking of blood vessels around your heart. Blocked valves or arteries can eventually lead to having a heart attack. In other cases, you could have a stroke, which is when the blockage in the blood vessels comes loose and makes its way to the brain. When it is in the brain, it causes a lack of blood flow, which in return causes a lack of oxygen to that region of your brain, causing your brain to die. Depending on how serious the stroke was, it can cause retardation, lack of motor skills, speech impediment, and many more life-changing disabilities. Worldwide, almost 9 million women die from heart disease yearly. This accounts for 1/3 of the total death count of women. Today, 1 in 4 women will die from heart disease. Women are twice as likely as men to die within the year after having a heart attack. The best way to prevent and manage the risk of having heart disease is managing the risk factors. Some risk factors include high blood pressure, high total cholesterol, or high blood glucose levels. The best way to see which of these factors you are at risk for is to get a screening. Your doctor will check your blood pressure, because this is the one that has no symptoms and is often overlooked. Next, your doctor will draw blood. This will test your cholesterol, good and bad, and will also check your triglycerides. Since the amount of deaths has gone up significantly from heart disease, many people have been going and getting unnecessary screenings. If you are an active, young adult, then you really don't need to get a full screening. Some of the tests done can actually cause more stress on the body than is needed if you don't have any of the risk factors. For most healthy adults, a normal physical will do just fine. Though, women over the age of 30 should schedule annual heart checkups. These are a lot easier and a lot less stress on the body than the screenings. Many people all over the world have fallen victim to heart disease. It has become the #1 killer disease in the world, and it only seems to keep progressing. You can avoid being in these statistics simply by having a regular checkup with your doctor, live a healthy lifestyle, and changing a few bad habits. In both men and women, quitting cigarettes will greatly reduce any chances of getting heart disease. Just a few simple steps will help you live a healthier, longer life.